So this question is on HIV/AIDS. So definition of AIDS is a CD4 cell count less than option A 800, B 600, C 400, and D 200. So basically, you must know the difference between HIV and AIDS. I hope everybody knows that. So HIV is human immunodeficiency virus, and AIDS is the clinical syndrome that is caused by HIV infection. So once a patient gets an HIV infection, he goes through several stages. And AIDS is the final stage of HIV infection where the patient has developed several conditions which had resulted due to the immunosuppression caused by the HIV virus. So AIDS is the outcome of chronic HIV infection and the consequent depletion of CD4 cells. So the CDC definition for AIDS is either a CD4 cell count less than 200 cells per microliter due to HIV infection, or the presence of any AIDS defining condition regardless of the CD4 count. So in a patient who has got an HIV infection, if the CD4 cell count drops to less than 200, you call it as AIDS, or irrespective of the CD4 cell count, if the patient has any AIDS defining condition, that is known as AIDS. So what are those AIDS defining conditions? Let us see. Before that, we'll see the natural history of HIV infection. So you know that HIV infection is acquired through blood, body fluids, sexual transmission, then percutaneous exposure, mother-to-child transmission, etc. And there'll be an acute infection which can manifest like a flu-like symptoms. So which occurs within the first 2 to 4 weeks of contracting the virus. After this virus will enter into the lymphoid tissue throughout the body, and they'll go into a state of clinical latency. So it is during this clinical latent period, slowly the virus will destroy the CD4 T cells in our body. And this latent period can last for many years. So usually it is around 8 to 10 years. After this, ultimately at a point, the CD4 cell counts become so low that the patient will become susceptible to several infections, malignancies, etc. And such infections, you call it as opportunistic infections. Opportunistic infections. And AIDS, as I already told, is defined as the syndrome when the CD4 is falling below 200, or there are some AIDS defining conditions. So coming to the AIDS defining conditions. So it is difficult to remember all of these conditions, but you must know that these are most of the opportunistic infections. So some of the common opportunistic infections which you can find in HIV/AIDS, they include fungal infections like cryptococcosis, then parasitic infections like intestinal parasitic infections like cryptosporidiosis, then viral infections like cytomegalovirus disease, mainly causes cytomegalovirus retinitis or CMV retinitis. Then patient can have disseminated tuberculosis or extrapulmonary tuberculosis due to mycobacterium tuberculosis. Then pneumonia due to pneumocystis jirovecii pneumonia. Then in brain, you can have a toxoplasmosis. Then you can have another infection in the brain known as the progressive multifocal leukoencephalopathy. Then you can also have some AIDS-defining malignancies. So there are some AIDS-defining malignancies which you must know. One is an invasive cervical cancer. Invasive cervical cancer. The other includes Kaposi sarcoma. Kaposi sarcoma, which is caused by Kaposi sarcoma herpes virus, KSHV. And you have different types of lymphoma. So one important is a Burkitt lymphoma, and other one is a primary CNS lymphoma. So you have to remember these 4 AIDS-defining malignancies: invasive cervical cancer, Kaposi sarcoma, Burkitt lymphoma, and primary CNS lymphoma. So these are the main AIDS-defining malignancies. And you must remember some of the AIDS-defining infections like cryptococcosis, pneumocystis pneumonia, toxoplasmosis, cytomegalovirus retinitis, then intestinal parasitic infections like cryptosporidiosis, isosporiasis, etc. So whenever the patient with HIV infection show any of this opportunistic infection, then also you can tell that the patient is having AIDS. Now, WHO has given a clinical staging for AIDS also. So there are basically 4 stages: stages 1, 2, 3, and 4. So I have already told, so there is an acute infection, then the patient goes into clinical latency and then into AIDS. So the acute infection is manifested as a flu-like syndrome. You also call it as an acute retroviral syndrome. Then it goes into these stages. So first stage, it's mostly that latent period where the patient is asymptomatic, or the patient can have a persistent generalized lymphadenopathy. A generalized lymphadenopathy which can last for a few weeks or months. So that is what is known as persistent generalized lymphadenopathy. And then the patient goes into clinical stages 2, then 3, and then 4. So this main opportunistic infections which we described, so all this will come under clinical stage 4. So no need to by heart all these entities, but you must know that the opportunistic infections and malignancies which we have described as AIDS defining conditions, so they mostly belong to the clinical stage 4. So I hope that is clear. So let us see the answer. So the definition of AIDS is a CD4 T cell count of less than 200. So it is not 400. So this is less than 200 as per the latest CDC definition.